So I'm going to be talking about having a designated dry eye clinic in your practice. All of our speakers have tried to make this very, very dry subject a little more interesting. Now, why is dry eye actually so important these days? This was a study published by the Artery Center group that showed that the prevalence of dry eye disease in North India was increasing, and it had reached about 30%. And majority of these patients have an evaporative kind of dry eye. Now, the typical dry eye patient, as we have discussed, he feels very helpless because everyone thinks it's no big deal. All anyone does is change his lubricants. He can't understand what's going on, and people keep telling him that he's thinking too much. The typical surgeon treating these kind of patients think it's a waste of time. The patient is back, khoon chusne wapas aa gaya. He may be just psychiatric, or it's just too boring and it's not worth the trouble of treating such a patient. So how can we change this scenario to one in which the patient and the doctor are happy? Now, why I feel you should set up a dry eye clinic is because of these particular points. One is to streamline your workflow. Now, these patients require a lot of chair time. You can't simply wish them away. So you need to give them a good amount of time to listen to their complaint and actually reassure them. That's pretty much the most important thing in these patients. Investment, we've all spoken about how these equipments cost a lot of money, but I'm going to take you in the subsequent slides through how you can actually set up a dry eye clinic without incurring too much cost. It's a specialty clinic. You can charge a higher fee for this, including for your investigations. There's an increasing incidence of evaporative dry eye, as we have discussed, because of the COVID pandemic, increased use of screen time. And it's important for your refractive and premium IOL practice as well. So having something that helps you diagnose these patients preoperatively definitely adds to other aspects of your practice. Okay. So what do you actually need in a dry eye clinic? Well, you need a vision chart, which we all have, questionnaires, either the SPEED or the OSDI questionnaire, which again does not cost too much money. You need something to help express the meibomian gland, something like a Mastrota paddle or a gland expressor. Again, this is not a very expensive equipment. Epilation forceps to look at things like Demodex, take out the eyelashes and actually study that. You need your usual Schirmers, fluorescein, and rose Bengal strips. You may need punctal probes and punctal plugs if you're going to treat these kind of dry eyes. Now, coming to the workup instruments, the expensive equipments we were talking about, the key is you may have various different instruments available in the market, but the key is to choose a diverse one, something that gives you pretty much everything in one equipment itself. So you have something like the LipiView or the ocular surface analyzer or the keratograph. You need to have something that gives you non-invasive TBUT, lipid layer thickness, images of the anterior segment, meibography, all this together in one, and that really helps to lower the cost of the equipment as well. So like I said, non-contact TBUT, meniscometry, lipid layer thickness, and the most important thing is looking at the meibomian glands. Again, you may not necessarily need a specific equipment for this. You could even use your autoref or any infrared camera, which would do the same. So I agree with what Pooja said. It is a great way to explain the problem to the patient, because then you can show the patient this kind of image, explain that your lipid layer thickness is poor, or you're not blinking properly. There's a poor gland architecture, which may be responsible for your symptoms. And it is also helpful post-operatively to actually make the patient understand what is going on and why he's got that khatakna or irritation in the eye. It also helps us to guide treatment. So say a patient like shown in the image on the left, this patient may not benefit from therapy targeted at opening blocked glands because the glands do not exist in this particular patient. If there is inflammation, you know that you don't want to put punctal plugs. It's more important to use anti-inflammatory agents. If there are partial blinks, you want to advise the patient regarding blink hygiene and MGD treatment. So this is how it helps us to guide treatment. This is a workup sheet which we have created in our clinic. This gives the patient a proper report. He actually feels very happy seeing this, that what is exactly going on in his eyes, their numbers, he can put figures to it and actually understand what the problem is within his eye, which puts his mind at ease. So the ideal equipment, there's no one perfect ideal equipment, but this is how you should go about choosing an equipment, which means it should help in diagnosis. It should help quantify the severity of disease, guide your treatment. It should be repeatable, sensitive, and specific, and it should be, last but not least, value for money. Now, DUES has given a lot of importance to different diagnostics. The ones that I'm going to stress on are, one, your questionnaire, like I said. Aberrations, if you have an aberrometer, great, or you can look at it on even your topographers. Something that does a non-contact TBUT, a meniscometry, a lipid layer, meibography, all in one equipment. That is important. I put the osmolarity in purple because it's plus minus. What my personal experience with osmolarity shows that it's a very variable test and it's not very consistent. So it's not a very repeatable test. Although Hughes has stressed a lot on osmolarity, personally, I feel that it's something that we haven't yet got to measure properly as of now. So coming to innovations in treatment, you don't need to go specifically for high-end equipment for treatment. Even these eye masks that have come into the market, they're not bad value for money, and they do exactly what we want them to. It gives a good amount of hot fermentation and pressure, and it's very useful. Most patients respond quite well to these. Other treatment modalities like the IPL and vector thermal pulsations from LipiFlow, of course, are expensive. IPL does not have as much of a recurring cost. What we have to remember is that these technologies are still in an early phase. The cost of the consumables is reducing, and newer machines are coming out where the consumable cost does not kill the surgeon as much. So what effect does having a dry eye clinic have on your practice? Let's look at the effect on scaling up the practice. It's important to do a cost analysis before you're actually purchasing any one of these machines. Normally, even if you are a smaller clinic, a diagnostic machine, say like the ocular surface analyzer, would make sense because all you need is a slit lamp mount and you can actually put it on that, and it gives you a large number of diagnostic criteria which you can actually use to explain to the patients. High volume dry eye practices, institutions can also look at investing in a therapeutic machine. It is important to set up the clinic consultation by appointment. The reason that we're calling it a specialty is I'm not disagreeing with what Dr. Vandana said, that it's not strictly speaking a subspecialty, but these patients require a lot of chair time, which means that in the middle of your cataract or your refractive OPD, if you end up seeing dry eye, 3 or 4 patients can completely derail your OPD. The diagnostics cost anywhere between 7 to 20 lakhs. Each workup can be charged, if you do that entire battery of tests, between 2,000 to 3,000 rupees. So the potential to generate revenue is quite high, especially with just a diagnostic machine. The masks also help you to earn revenue, which can give you revenue in the form of your pharmacy. So in terms of profitability, it makes sense to have these machines. The educational material that you play, such as videos of warm compression and lid massages, help to create a connect with the patient. This improves conversion to other procedures like, say, punctal plugs or other premium refractive and cataract surgeries. If you're managing dry eye, which is a more severe form of dry eye, you should always have a connect with a good rheumatologist or immunologist, in which case there's a two-way referral system that starts where you can refer cases to them, and you are likely to get referrals back from them. There are certain benefits that are intangibles. It is, if we alienate one customer, it spreads to 10, which is a serious problem. That means one unhappy customer can have a major impact on your practice. Whereas if we look at it in the other way, one happy customer can bring in a lot more satisfied patients. Giving enough chair time also and treating these patients with enough patients makes your practice less vulnerable to price wars. There's consistent profitability that shows, because if the loss of a dissatisfied patient can lead to a massive loss of income over a lifetime of practice. So this leads to increased personal and professional satisfaction if you're able to satisfy these patients. In our own practice, we've seen that the marketing innovation where you put this up on your website, it generates a good amount of traffic online that helps you to convert not only for this, but also for other procedures like your refractive and cataract practice. So setting up a dry eye clinic, in short, does help to ensure that dry eye, which is a dry specialty which troubles both the patient and the doctor, helps it to convert it into more of a happy patient and happy doctor scenario. So I'd like to just acknowledge Dr. Himanshu Matalia, Dr. Naushir, and Dr. Rohit, who have always guided me in my dry eye talks. Thank you.